Hi there, I'm P H Bamaiyi, and today I would like to talk to you about mycotoxicosis. Now, what is mycotoxicosis? Mycotoxicosis is a disease caused by mycotoxins. And you would ask, what are mycotoxins? Now, mycotoxins are produced by fungi under certain conditions. Some fungi in the field or during storage produce secondary metabolites which are called mycotoxins. And these mycotoxins affect animals. And in this case, we'll be talking about pigs. Pigs are affected by mycotoxins. And mycotoxins are of great economic importance. For example, in the United States, the animal industry loses about $1.4 billion to mycotoxicosis in pigs alone. All right, so this is a frightening figure if you look at it. So, but we'll be concentrating on talking about treatment of mycotoxins in pigs. But before then, I would love to give a background about mycotoxicosis. If you look at this slide, you see that aspergillus is one of the fungi that can cause mycotoxicosis. Right, it produces certain toxins that are called aflatoxins. There are different kinds of aflatoxins. You have aflatoxin 1, 2, like that, different kinds. And of course, there are different species of aspergillus that produce toxins in grains, and subsequently, when feed is produced from these grains, you have these mycotoxins that will affect animals. In this case, we are talking about pigs. Of course, there are other toxins, also mycotoxins, present in feed that later will comment about them. Now, mycotoxicosis in pigs affects almost every system of the body of the pig. It affects the digestive system to some certain extent, the respiratory system. For example, one mycotoxin that is called zearalenone can cause enlarged swollen uteri in pigs. It can also cause shrunken and or cystic ovaries. It can also cause necrosis or reddening of the tail. It can cause vulvar swelling and reddening. It can cause vaginal and rectal prolapse. It can cause immunosuppression. It can cause liver damage. It can also cause decreased litter size and birth weights. It can also cause decreased male libido and can cause infertility in female animals. So if you look at it, you see that only one mycotoxin, okay, called zearalenone, is affecting almost every system in the body of the pig. So the effect of mycotoxins on pigs is actually quite phenomenal, especially if they are young pigs. The effect can be fatal a lot of times. And if you look at this slide, you will see that this gives a summary of the major mycotoxins that affect pigs. For example, ochratoxin. Ochratoxin can cause renal lesions in pigs, and we've mentioned about zearalenone. It can cause vulvovaginitis and prolapse and even embryo mortality. We also have another mycotoxin called ergot, and ergot can cause gangrenous lesions in the appendages. And we have another mycotoxin called aflatoxin. All right, aflatoxin can cause hepatitis, and it is perhaps maybe the most popular mycotoxin that you encounter in pigs. We also have some other mycotoxin like fumonisin. Fumonisin can cause certain effects in pigs, which includes interfering with the cell cycle control and cell function in the body of the pig, and this can lead to a lot of other conditions that affect almost every system in the pig. We also have other mycotoxins like the T2 toxin, the DAS toxin, and various other mycotoxins. And one popular mycotoxin is the one that is called vomitoxin. Vomitoxin is, I think, got its name from the fact that it makes pigs to vomit and keep vomiting a lot, and to reject feed. So if you look at this slide again, you see some more details about the effects of mycotoxins in pigs, and you will see that the effect is quite devastating, and it's a great economic loss to farmers when mycotoxins affect pigs, especially young pigs, piglets, more susceptible to mycotoxins. And you see that the susceptibility of pigs to mycotoxins depends on a lot of factors. Age comes into play, sometimes the sex come into play, the duration of exposure, the humidity, the temperature, other toxic entities, the nature and level of mycotoxin concentration, the nutritional health status of the animal also matters. All right, so all these factors come into play in determining the kind of effect that mycotoxins will have in pigs. But uh, today, I actually just want to talk briefly about the treatment of pigs that have mycotoxicosis. Now, you look at this slide, you'll see what I would call the major mycotoxins that affect pigs, and they include aflatoxins, ochratoxins, trichoticins, ergot, zearalenone, and fuminicins. Now, if you go to a pig farm and you suspect that the pigs are having some kind of mycotoxicosis or the other, what would you do? Now, let me straight away say something very important, and that is that prevention is always better than cure. Take care of it, as effective therapy is generally not available. Okay? It is better to prevent than to treat mycotoxicosis. So, if proper care is taken to prepare the feed for pigs under hygienic conditions, to ensure that feed that have mold, some fungal growth on them, and not put as part of the feed for the animal, if proper precautions are taken to ensure that the animals get healthy feed, it is going to save the farmer a lot of money. Okay, so it is very important that farmers are educated to ensure that they take care of feeds, because there is no effective therapy, generally speaking, uh, to handle mycotoxicosis. So, if grains are suspected to have some form of mycotoxins, the grains can be treated with sodium bentonite, and they can also be decontaminated with anhydrous ammonia. Anhydrous ammonia can be used to decontaminate the feed. Now, I have already made an important point about prevention, because generally, pigs do not respond to treatment against mycotoxins. So this is very important. Generally, they do not respond. They respond to treatment of for mycotoxicosis is not very good. Okay, so but most of the time we'll provide some form of supportive treatment and some form of symptomatic treatment of this condition in animals. Uh, for example, if an animal is suspected to be having aflatoxins, uh, it can be given vitamins. Vitamin A, vitamin D, vitamin E, vitamin K, and the B complex vitamins can be administered to the animal. Now, this is a form of supportive treatment, by the way, and hoping that the immunity will be able to fight off this condition, these mycotoxins. So, vitamins can be administered, and because the immunity is depressed as a result of these mycotoxins, sometimes a bacterial infection could come in. All right, so you do well to also treat for secondary bacterial infection. Secondary bacterial infection should be treated. Now, another thing is I've already mentioned generally we do supportive and symptomatic treatment, but if pigs are suffering from mycotoxicosis as a result of these mycotoxins of the family of the trichoticins, which include the T2 toxins, which includes the DAS toxin, that is diacetylsaphenol, or the DON toxin, which is deoxynivalenol. There is something that can be done, and that is the use of antiemetics, because usually if pigs are having mycotoxicosis as a result of deoxynivalenol, mostly the trichoticins generally, the pigs will keep vomiting. That is the toxin that is called vomitoxin. All right, so they keep vomiting, and they will lose their appetite, of course, so they will be off it. Okay, so antiemetics can be used, but not just any kind of antiemetics. It is very important to use antiemetics that are antagonists of serotonin, because in mycotoxicosis, as a result of trichoticins, there is elevation of serotonin and tryptophan. Okay, so you want to use antiemetics that will specifically be acting against serotonin. An example of that is ondansetron. Ondansetron. Another example is granisetron. You can use these antiemetics to stop the vomiting in the pigs, and hopefully the pigs will be able to resume feeding, and then they will pick up from there. Okay. Now, another thing you can do is in a toxin called zearalenone, in which you can have rectal prolapse, vaginal prolapse, so you can treat this medically. Okay, surgical procedures can be carried out to correct the rectal or vaginal prolapse, right? So you try to take care of the